I'd like to share with you some of our recruiting initiatives, how we promote health, and how we promote health, and briefly touch on training, but only briefly. And let me just quickly explain who we really are. We are the second largest private healthcare provider in Germany. We have over 170 healthcare facilities in 14 federal states with a lot of employees, as you can see, 67,000. So that's a lot of people to look after. What do we stand for? Well, future-oriented medicine, like you all do. High standard clinical care available to all. So when I say we are private hospitals, the care is available to everybody. And continuous quality improvement, innovation, patient safety, and social responsibility. And we have a social responsibility for our employees as well, not just for all the other stakeholders. And this is our commitment. We commit each other or ourselves each day to make patients feel welcome and safe, well treated, etc. And we obviously have a program for our staff so that they can deliver the care, but at the end of the day, it's also about making our staff feel safe, not just our patients. So I call it our safety circle, and we have our staff in the middle who provide the care, and obviously we need to recruit employees to make sure that we can deliver the care that is required. We need to train them well so they can deliver the care, but at the end of the day, we need healthy employees. So we need to look at what can we do as an employer to provide or to promote health and provide issues. And at the end of the day, that's how we can deliver safe patient care. Let's start with recruitment. Our recruitment campaigns come in various shapes and sizes, and when I say sizes, at the end of that, you will see why I say sizes. We also use Instagram and Facebook and TikTok. So we have, this is an advert on Instagram. This is for we want to recruit new nurses, obviously, so it's the age group that's on Instagram. We have Facebook. So there you would end up directly on the career site of Asklepios if you were to click on that. We have actually, this is I think also on Instagram, and let me just see if I can, oh hang on. Maria, I can't click on because there's actually a little video and I can't click on that. Does that work? Both of them are videos, short videos, which I meant to show you. No, it's the one before. But the doctor actually says, well, he moves and a heart comes up. He says, I want to be in medicine because my heart beats for it. And the other one, I think, I can't quite remember, I think is OR, is in the operating theatre, which is really interesting because they've done a fantastic little video. It doesn't work. Okay. Well, I'm sorry. I would have loved to show you that. It's not working? No. Because it's my own presentation, so, oh well, that's how it is. I think before we dwell, we just continue. Yeah, exactly. And now it's not working. Oh, right. Okay, then we have something very special in Hamburg. It's called Hamburg Headhunter, and it's nursing staff, recruit nursing staff. Actually, if you recommend a new member of nursing staff not yet employed by Asklepios, you can earn an award of up to 2,000 euros. And it's working. People have recommended potential colleagues. And what happens is if you click on that QR code down there, you end up on a Talentry app. And this Talentry app takes you through the whole process of recommending somebody. Then it tells you how far the process is, the recruiting process. Obviously, it doesn't give you any details, data protection, etc. But should that person have been employed, it will tell you that actually. And this app, it's very successful, but it's limited to Hamburg, which is obviously our biggest and strongest base with 7 hospitals. So that's a part of that. But our biggest advertisement is the first of our buses. I have to say the first is in the past we had buses with our old CI, our old colors. This is our new CI, and it says #UsForHamburg. So it's public transport, so just normal transport like you would use from here, from go to A to Z. And at the back, actually, it also has a QR code. And if you were to scan that, you would end up directly on the career site as well. And for those of you who actually are able to speak German a little, it is a word play. The word in German for Stationen, so that's a hospital word, is Station, but for a bus stop, it's also Station. So it says, we have many bus stops, so do you. So we have many Stationen, so do you. Let's click on that. So that is our biggest advertisement, so on a local level. We have many different other initiatives that I couldn't all show here because of the limited amount of time. But of course, it's not enough to look around in Germany for new employees. We need to look outside of Germany. So what we do is we recruit foreign nursing staff, and we have so far recruited from countries like the Philippines, Vietnam, Mexico, and India. And it is all a very legal process. We only work with local recruiters that carry the label fair recruiters to make sure there's no money going in channels that shouldn't be going, also from the potential employer's side. And how it works is we have requirements. All candidates must have a B2 language level of German. All candidates must be experienced nursing staff. And then it would work through 3 onboarding centers in Germany. One is for Hamburg. That is exclusively for Hamburg because we are the biggest employers there. One is Wiesbaden for the rest of all our outside hospitals. And we have Göttingen for our psychiatric staff because Asklepios has a fair number of psychiatric hospitals as well. So they would all be prepared and go through these onboarding centers. And once they arrive in Germany, all candidates will obviously attend so-called adaptation training courses. And depending on which federal state they want to work at, the process can take up to 1.5 years. Because Hamburg actually has the strictest rules, and it takes much longer than for the rest of Germany. You know, federal states, federal laws, it's all different. And on arrival, the candidate will be mentored by an integration representative that we all have at each hospitals. And this person will help organize anything from accommodation to work visa and whatever else may be required to ensure a smooth integration process. And once the employee has joined his or her team, she will then get also a mentor within the team for the induction period. A very big added bonus is that we've got a law in German, which is a residence permit family reunification. That means once the employees are established in Germany, they have a permanent residence visa and are able to support themselves and their families. The families can actually move to Germany. And that applies for spouses and children. Doesn't apply for parents. It's only spouses and children. So that, of course, is a very big incentive for foreign employees to come to Germany. Yes, obviously, what can they expect when they come to Germany? And anybody who joins us, and as I said, I briefly touch on employee training and development. We have established a patient safety program, and it has a number of things from our safety standards, critical incident reporting, obviously employee qualification with regards to further education, audits, OR safety, etc. Of course, that's part of the training, not on all levels, depends on which area you work at. And we have our own training centers in Germany, which is a very big bonus. We have 12 training centers for nursing care, but we also have an academy for continual medical education for doctors, using the most modern methods, because we've all learned through the pandemic it's not necessary to be on site. We can do it with all sorts of things, teams, etc. But we've also got our own medical school in Hamburg. And we work together with the Semmelweis University in Budapest, which is our partner. And again, a bonus here is the doctors are trained there, they do their internship at Asklepios, and then those, particularly those who come with a grant, later work at our hospitals. So that means they already know how things work in our hospital. They know our standards, etc. So that I think is a big bonus. And last but not least, the quality division that I work for, we provide training as well. So that's on a corporate level, and it is geared more towards quality managers. We qualify our newly recruited quality managers. We have certain requirements, clinical risk management, incident reporting, project management. They need to take those courses over a number of maybe a couple of years, because at the end of the day, they also need to carry out their work. And we also qualify our own internal auditors so that they can carry out audits, etc. So they are our multipliers who carry our standards into the hospitals, which I think is really, really good. So that was only briefly what people can expect. We do have everything set in place for good training, but at the end of the day, all our training, whatever we provide, doesn't work if our staff isn't healthy, isn't motivated. And of course, it is also up to us as an employer to make sure that we can provide mechanisms set in place to help promote health. And I think, if I'm not mistaken, that is my last point, employee health, and what we do or have set in place to help our employees. You know, you all know, a healthy mind and a healthy body, this is what we all strive for. Doesn't always work with daily challenges, not at all, whether you work in a hospital or elsewhere. And, you know, in the past, people thought, well, the odd fruit basket delivered to the office, that was enough to promote health. No, it's not. You need much more to create a positive work culture and healthy employees. And we have therefore implemented a comprehensive health management program to support our employees' well-being, mentally and physically. So what does it look like, health promotion and prevention? Well, we have our Center for Occupational Health and Safety. We have occupational medicine. We have insight intervention, employee smartness, and that is something that I will go into in a minute. We have Asklepios Active or Active, and we also have our prevention representatives. So far seems nothing out of the ordinary, but there's a couple of things that I'd like to point out here. Employee Assistance Program, Insight Interventions. I think when we look at our staff, we look at the daily challenges they face in the hospitals, the workload, etc. But sometimes we forget that outside factors also influence our staff. Do I have problems in my family? Do I have money problems? So there is a lot of outside factors that can influence the ability to function properly, to work properly, and to deliver safe care. So Asklepios has recognized that there is a more holistic approach needed when it comes to employee health, and therefore in 2019 it founded Insight Interventions. Insight Interventions is actually a merger between Asklepios Connecting Health, which formerly provided mainly psychological support with psychologists that you could get appointments with, etc. But they merged with Mine ERP, which was an assistance employee program, and Terlingo EAP, which means we now have two, or actually three, very, very good partners for this program. And what it does is we have over 250 experts working for Insight, offering telephone, on-site, and video advice and support to members of staff for a whole range of subjects like work-related problems, obviously. We have physical and mental health. We have emergency and crisis, law and finance, and, for example, partner issues. And that's only to name a few. And I just quickly tell you how it works. So we have an 0800 number for this. So if an employee realizes he or she has got a problem and they need help from a third party, I mean, it is a big step to actually acknowledge that you need help, he or she can actually call this 0800 number. It's totally anonymous. Nobody writes down, Mr. So-and-so. It's only kept inside. Asklepios would not know, which is very important. I think this anonymity factor. They would then be directed to a case manager. The case manager would note down the problem and then forward it to the appropriate advisor team. And the advisor team would then get in touch with that employee. And it can be anything. They can provide, for example, if you need a psychological support, we now have the possibility to do that by video. If you are in Hamburg, you can actually do it on site because our psychologists are based in Hamburg. But of course, the majority of our employees are not in Hamburg and they need the support. So whatever it is, also, let's say you need a nursing home, or which are very hard to come by, as we have heard from Kirsten as well, very big problem. They will help you in all aspects of life, which I think is totally amazing. And in 2019 and 20, it wasn't used so much because that's when the pandemic started and people really had other issues and they didn't ask for help. It only started afterwards when things were cooling down just a little bit. I can't give you numbers yet how effective it has been, but the benefits that hopefully we will at some stage be able to evaluate are prevention, obviously. If you have somebody to talk to, you have a mental problem, it can prevent further suffering, so that is certainly a win-win situation. You have less staff fluctuation because if you feel appreciated, and there's this big word, appreciation, and supported by your employer, you tend to be more loyal in return. Reduced absenteeism, a big problem that we've got due to illness, etc. So if problems are addressed at an early stage, unnecessary stress might be avoided and it might not have a negative impact on your immune system and you won't become ill. That's obviously, that's what we wish for. Less work accidents because you can concentrate better if you have less private or work concerns. And you have more motivation and a better job performance, which at the end has a very positive effect on corporate success. So that are the positive effects of the Employee Assistance Program. I've picked something else that we have. It's called Asklepios Aktiv. It's on our website. We have an intranet, social media intranet site. And this site is the umbrella term for a large number of health promotion services that we offer both on a corporate as well as on an individual level. And the focus lies on mobility, on nutrition, and stress management. And when I say corporate and individual hospital level, is obviously all our hospitals have their own initiatives they offer Pilates, cooking classes, etc. But there are also things that we provide on a corporate level. So if you were to go on this website, you'd find subsites with how can I relax, what can I do for my soul, there are certain techniques from posters to videos. We also have fitness, even fitness at work, what can we do to remain fit, and we have a lot of nutritional advice. So I really like those websites because some of the things are very, very simple, just to say, drink 2 liters a day, things that we sometimes forget, or little changes with big impacts, and healthy snacks, those kind of things that we promote there. And I think those sites have become very successful, actually, because there's easy access. And of course, we have health promotion corporations. We have with fitness clubs. Bäderland, for example, in Hamburg is the sort of corporation of all our swimming pools. You get reduced rates if you go to fitness clubs. And we have Jobrad. So that actually promotes coming to work by bicycle. At reduced rates, you can get excellent bicycles. And those are just some examples of the initiatives that we have to promote health for our employees. So this is our safety circle. We need to look after our employees because if we don't have employees that feel safe and that are good at what they're doing and that they feel appreciated, they can't deliver the care that we want. And it's all very well to talk about patients and safe care, but we need to concentrate a lot more on our employees. However, sometimes it feels like a drop in the ocean when we look at how short we are of staff, and we need so many. Thank you.